been with us earlier on speaking about the, the revenue sharing matters. But now let's delve into matters of this county, for instance, and we're in the unfortunate time of the COVID-19 pandemic. First, how ready is your county for this? Because we've been seeing a number of counties who are not, at the recommended 300-bed capacity for the patients.
Well, we are not at 300 yet. We are at 217, and we are still working on adding the numbers. Obviously, our population, when you say 300, sometimes it looks the golden number, but it also depends on the population. We have 268,000 people, and we feel the 217 is, even if not adequate, is where we'll head there, but we have 217. We have 13 beds for ICU, 7 of which are ICU beds and 6 are HDU. We have formed as a county the County Emergency Response Committee, which is chaired by myself and the County Commissioner. We've been meeting every Thursday since then, and we have trained 100% the health workers in the public health facilities. Now actually we are heading to train health workers in the private and faith-based health facilities. We have just added to our 7 ambulances, 3 new ambulances actually. As you are coming here, you found us launching 3 new ambulances that now will add to our preparedness in terms of getting patients from the rural health facilities should the need arise.
Okay. Sorry, I just want to just come in and bring up the fact that there was once the concerns that you had, leased beds for the hospitals, and you denied it. Give us the context of this, and you said it was a rumor. From where?
Well, I must say that as soon as we realized the need for ICU beds, being the chair of health, I contacted MEDS, and we were actually very lucky that those were the only, we ordered for 27 beds from MEDS, and they only had 13. So we were among the earliest counties to procure from MEDS, Mission for Essential Drug Supplies, and they brought it themselves. They fixed it at our ICU, that's the KMTC, which we converted to ICU and HDU. And they trained our people on how to use the equipment. But later, Kenya Medical Training College in Nairobi gave us 2 nurses, 2 ICU training nurses who will train our own nurses. Now the training is ongoing. So, well, where did it come from? It's political competition is there, but in Isiolo, political competition is becoming too low in terms of the way people compete. People should compete on what they also do. People should compete by fact-finding, so that when they find us having done mistake, they get their facts right. Because, in fact, you will realize that the photos that were, this is orchestrated by the senator, who actually even took it all the way to Senate, and it was raised on the floor. It's even a shame that it is raised on the floor of the Senate. And if you realize, you will see that the vehicle at the facility is a black vehicle. The vehicle outside our gate, that the hospital the hospital gate, is white vehicle, a white pickup. There is no photo showing the vehicle inside, it's outside. There's no photo showing off-roading. It's just all outside the hospital, and it was at the gate of a Galaxy facility. This matter was investigated by DCI, and they gave us a report when all the leaders, including the senator herself, was seated there. And they said that they have gone to MEDS, and they have confirmed that actually those beds were procured. So we procured our beds from MEDS, 13 of them. The issue of Galaxy is a machination of people who want to always put negative on whatever positive we do. We just launched 3 ambulances. Now the rumor in town is that that was given by a national government. So everything we do must always be put in the wrong context. And I don't think that is competition, especially when we are talking about COVID, which is a pandemic that is killing a lot of Kenyans right now, which is actually surging, which even everybody is having, all leaders are having sleepless nights because of the worries they have on the future of their population, because it's not only about the death, it's also about the economic impact. So in such situations, leaders should not play below the belt.
Okay, so don't you think that this, because it seems there's some disjointed relationship in terms of the county leadership between yourself, the senator, don't you think these things are actually going to affect what Mwananchi really wants? Because ultimately, Mwananchi may not care much about who put what photo, etc. They just want their basics provided.
That is what we are doing, because we are focusing on delivery. Let those who are talking talk. It has started with bursary. They said bursary was stolen. We showed the bank statements. We actually delivered and distributed the bursary. It became a lie. They said LN 150 is about taking away people's land. We didn't take people's land. Now Kina and all these other places, we are being surveyed. Very soon, in 1 month's time or so, we are going to distribute 294 titles. Land is not being stolen. Titles are being given. That is becoming a lie. They said Baraza Park is being stolen. That Baraza Park has been investigated. It's a private land which we gave back to the owner. It became a lie. ICU beds, they said we leased it from a private. It's become a lie. Everything we are proving day by day that we try to do, and we are not concerned. It's just now that you're asking me here. We don't talk about it. We just deliver. You have seen the market. You have seen the stadium. You have seen the office. You have seen a KMTC that we have built. And you have seen the kind of improvement we have done on health. We are just focusing on that.
Okay. Okay. And now let's talk about something different. And this is one that has is an unfortunate tag on the county of Isiolo, that of being a radicalization, terrorist radicalization place. And it has been something that has been there. It's public knowledge. Where are we with that in terms of course, there have been efforts and pledges to address the issue and try and ensure that the youth are not, pulled into these vices as well as drugs, because we hear bang is seized so many times in this area. So maybe you could talk to us about that and tell us what is being done or what has been done.
Well, youth empowerment is our main focus, because what you're saying is true. Because there is a lot of frustration. Unfortunately, for a long time, the performance in schools have not been very well. So you will find a lot of siblings in the same home, 4 siblings staying at home, and all of them not having anything to do. That obviously leads to frustration. That leads to now the kind of things you talk about, engaging in drugs, being easy targets for recruitment into terror groups. It's true. And Isiolo for some time has been actually known in that negative aspect of recruitment center, which we have now worked very hard. Actually, that matter is really, really, and I'm very grateful to the religious leaders, to the all the leaders who have partnered to make sure that we reverse that trend. About the bang, I want to clarify one issue, that this is a conduit. As much as there's a lot of consumption of bang here too, but there's a conduit, the source is Ethiopia, and it comes through, because this is the only route heading to Nairobi, and they also take through the bushes in Merti, Kina, and entering Meru up to Nairobi. So we have programs, and we have formed partnerships also. As a county government, we've done programs with the young people. We have even taken them to training at Kenya School of Government so that they learn how to do businesses. Those ones now we want to give them funds so that they can now start those businesses that they have been trained for. We have also partnered with Kenya School of Government here in Isiolo and Kenya Film Classification Board. In fact, Isiolo is going to be the hub for a school of film. We are establishing a school of film in collaboration with Dr. Mutua of Kenya Film Classification Board. We have established this big project for them, the stadium, because a lot of our young people are talented, and we have sent people outside this country to join various football clubs. We have even formed a girls football club here in Isiolo, and they are doing very well. They actually won in the regional competition. So we want to nurture this talent. That's why we are putting up this FIFA standard stadium, so that the young people can actually nurture their talent and then be able to follow their career in terms of
So basically
sports.
you're confident that the issue of terrorism is already going down?
Of course, yes.
As well as drug addiction and drug abuse?
Well, that one we are working at it. I must say is a major challenge even right now, and I'm glad there are also the young people themselves have formed organizations to address this. We are partnering with NACADA, we are partnering with the national government, the county commissioner is on top of these things. We actually had a meeting which involved all leaders and even the county commissioner just about 2-3 weeks ago. And we said we should all be able to focus our attention to this, because it's a major challenge and it's something that we need to address in this county.
Okay, there's a lot of things we can talk about in this county, but we've covered a number of them. For instance, in the weekend that we've been here, like you mentioned, from infrastructure to the livestock and the likes. And these are some of those that we had not addressed, and we're glad you've spoken about them. We've been speaking to the governor of Isiolo County, that's county number 11, that is Mohammed Kuti, who's been telling us about the different aspects. Healthcare, especially this time of the COVID-19 pandemic, is a significant concern. And we'll still be giving you more stories from this county, so you can get to experience what Isiolo is all about, beyond some of the stereotypes that have been on its neck for many years. We'll come back with more